Dr. Tursi, it's a pleasure to have you here speaking to the Brazilian doctors. And you are most important researcher in diverticular disease and his treatment. Well, how did you get the idea to start the use of mesalazine in diverticular disease?
Yes, mesalazine was one of the most important treatment strategy which is currently investigating at present. Because mesalazine is an older drug which is widely used in the last years in the treatment of inflammatory bowel disease, but probably thanks to new knowledge about the pathogenesis of the disease, mesalazine may be a good choice in that patient. Probably patient we have significant symptoms, patient showing inflammation, patient showing recurrence of symptoms in which we probably have a significant inflammation also, not only by the symptomatic evidence of the disease, but also looking at the inflammation, for example, performing a colonoscopy. And so in that patient, probably mesalazine is the good choice in order to prevent the recurrence of disease, in order to prevent in particular the occurrence of complication, mainly diverticulitis, which is the main problem in that patient. We cannot forget that diverticulitis may have a lot of complications. Most of patients may have severe symptoms, most of patients require surgery, most of patients died today for diverticulitis. So our study are currently advised in order to define clearly how to treat this patient and which is the best dose of mesalazine to give to that in that patient.
Well, what do you think about the whole of surgery nowadays in the diverticular disease? Do you think that it's going to change with this new approach?
Probably the consideration, the pathogenesis of the disease is probably better understood today. And then also the role of surgery is probably changing in this last year. We know that surgery is the first choice in complicated diverticulitis. So medical treatment is only a treatment which support surgery. But in patients with uncomplicated disease is under still active debate. What should we do in that patient? We should operate after the first, the second, or the third episode of acute diverticulitis. The answer is not clear. We don't know what is the best approach for surgery. Probably the patient should be clearly investigated, they should be clearly analyzed before to undergo to surgery. The current guidelines advise to use surgery after at least 2 episodes of uncomplicated disease. But probably also this advice is not the correct choice because patients should be investigated about a specific history and specific history of the duration of symptoms in terms of years, in terms of symptoms, in terms of complication. Patient with complicated disease should always treated with surgery. The surgery is the first treatment in that patient. But patient with uncomplicated disease should be analyzed in depth before to undergo him to surgery.